Hi there and welcome to Plant CEO. In today's episode, I'd like to welcome Dr. Laura Freeman, the Medical Director and co-founder of Plant-Based Health Online. Hi Laura, how are you?
Hi, I'm good, thanks, Anand.
Great to have you on the show. I'm so excited that you're able to speak about this new initiative of yours, and really excited to learn more about it. Thanks very much. And where are you at the moment?
I am in Glasgow at home. I found a corner of quiet whilst in between homeschooling and working and all the rest of it. So
awesome. So before we learn more about Plant-Based Health Online, can you just start with going over your background?
Yeah, for sure. So I'm a GP. I went to medical school here and did my GP training here, and then married a Canadian who kind of managed to get me to agree to spending a year or two in Canada, which turned into a lot longer than that, because basically when I got there, I decided that I thought I was going to do a master's in clinical education when I got there, but I ended up doing my GP exams, so the Canadian board exams, when I was there, and I opened up my own practice there. And I did that for a good long time. So I was there for 8 years in total. But really, I guess the start of my journey actually happened when I became the patient. So in 2016, when I was pregnant with in my second pregnancy with my daughter, I was diagnosed with thyroid cancer. So my obstetrician had found a lump in my neck during my kind of standard 12-week appointment, and we had kind of decided to leave things be during the pregnancy and follow up as soon as I had the baby. And after, when my daughter was born, she actually had her own various health conditions, and she's fine now, thank goodness. But at the time, I was a very tired mummy with a 2-year-old and a baby at home and working as well, that I kind of forgot about my own health. I think doctors are notoriously bad at patients. But anyway, I had also discovered with the diagnosis, when I went for my blood work before my operation, that my cholesterol levels were extremely high. And that kind of surprised me, because I thought I was eating well and living a healthy lifestyle, but it really kind of forced me into looking into like the exact details of my diet and what was good and what was bad. And I stumbled across How Not to Die by Michael Greger, which I'm sure you've read or are familiar with, and was really quite amazed by what I was reading. Kind of discovering that the chicken and the salmon and the eggs and all the dairy that I was eating was actually not as good for me as I thought it was. So very quickly made changes to my diet, and then was really surprised and amazed to see that my cholesterol levels were quickly dropping, and also that the recovery from my surgery was quick, and at least from a physical point of view anyway. And so really kind of immersed myself in this research in nutrition, which I'd never had before, like either as a medical student or as a GP trainee, or even, repeating my exams once I had arrived in Canada. I had just had, maybe a handful of hours of education on nutrition. So it was really amazing for me to see that in my own personal biomarker profile. So that was really incredible. Then as I kind of continued the research and read more and watched all the documentaries and made more changes to my diet and my lifestyle, I then started to translate that into my professional practice. So I would be getting to work and feeling like I was really doing my patients a disservice if I wasn't telling them about everything I had found out, right? So I was starting to give them choices, like you could increase your metformin for your diabetes, or, we could talk about making dietary changes. And what was amazing, apart from the fact that so many patients were really happy and really ready to talk about that and have that discussion with me and to make changes. But then the success that I saw was just really incredible, and I had never seen anything like it before. So I've been a doctor now for 15, maybe nearly 16 years, but it was only then, which was about 4 or 5 years ago now, that I started to realize that people could improve their diabetes depending on what they're eating, or come off their blood pressure medications, or reduce their cholesterol medication. So that was really amazing for me as a GP. But then at the same time, I also felt like, well, I hadn't been taught about nutrition before, and who was I to start counseling people on their diets? And I then discovered, so I was in Toronto at the time, and I found that Harvard Medical School were doing a course in lifestyle medicine. And in North America, lifestyle medicine is very plant-based focused. So I took myself there for the course and kind of was on the edge of my seat for the whole, 4 or 5 days that I was there, really feeling like I had found my calling within medicine. Really super inspired and super motivated to go back and put into, like, again, further my practice with my patients about incorporating plant-based diet, exercise, stress management, developing social connections, all those pillars of lifestyle medicine, which we can go through later. But yeah, so that was that's taken me on my journey from having left the UK to getting to Toronto, to having the diagnosis that I did, discovering plant-based nutrition, and then putting it into practice with my patients, only to then come back to the UK and want to put it into practice here.
It's an amazing story. And on the cancer, there's been no remission since, obviously, you've had the surgery and you're all clear. Obviously, you think that diet had a major impact in terms of your recovery time as well?
Yeah, I really do. I think that it's played a really big part in my recovery, like not just with diet actually, but also now getting into really consistent exercise regime and making sure I'm managing my stress properly, something that I wasn't doing as a very burnt out GP when I was there. But it's really highlighted for me that conventional medicine as we know it is super important, and of course I'm so grateful for it because it gave me life-saving surgery, and I rely on it now for, I take medication to replace my own thyroid levels, and I need to have ultrasound scans, and I need to see an oncologist, and so of course, like, I'm all for allopathic practices in medicine. It's so important. But it took much more than that to get me properly well again, right? Like, I needed to optimize my diet, and I needed to exercise, and I needed to start meditation and mindfulness and journaling and all these things to really find true healing again. And so that's been really important for me on a personal level, but it's also something that, because I've experienced it myself, I'm able to talk about it with my patients. And so I've always felt like I was an empathetic, like a compassionate doctor. But I think when you're a doctor and you experience things on the side of being a patient, I mean, it really opens up my eyes way more than, the role modeling that I had to do in GP training, or, even just having spent all this time with patients. I don't think any of it is a substitute for experiencing it yourself firsthand.
So it's interesting that you think that everything, like, holistically helped you get through it in that way. The stress management, the exercise, your diet, everything really helped you make that change.
Yeah, it really did. I mean, I think that at the core of it all is my diet. And I see that quite a lot with patients too, that although all of it's important and in different measures for different people and in different ways perhaps, but when you eat well, especially when you follow a really healthy plant-based diet, you often feel more energized. And when you feel more energized, you tend to exercise more. If you exercise more, you tend to sleep better. Right. You tend to have a more positive relationship with whoever you're sharing your house with. And yeah, it's just a really powerful ripple effect. So yeah, I think it's taken all of these things for me to really become well again. And like I said, I see that with my patients also all the time.
So you're practicing again, obviously in Glasgow right now. So you see your patients in the daytime, and what spawned this new initiative is just basically that your past experience. So you've created plant-based health online. So do you want to tell me a little bit more about that and how it works and what the platform is and the goal?
Hi, I'm Laura. I'm a GP and lifestyle medicine doctor. I've been seeing patients for over 14 years, but it was only when I became the patient I realised the true connection between diet, lifestyle and health. Now I realise that using evidence-based medicine allows for the opportunity to get to the root cause of disease and really improve my patients' lives. The benefits gained by this powerful approach extend through the whole body, and they ripple out to family, friends and loved ones. I know that lifestyle medicine works. I've seen it in my patients and I've seen it for myself. I'm so happy that you found Plant-Based Health Online. We're here to support you on your journey towards a healthier future. I'm really excited to have the opportunity to talk about it actually, because although maybe having recounted my story has made it sound quite streamlined and easy and it just kind of slotted into place, that really is not how it happened, right? Like I made changes to my diet and then it took me time to figure out my exercise routine. And I was in Toronto at the time, so I saw a naturopath and I saw a chiropractor and all these different people who were giving me different advice, and it did really take me time to find a place where I was feeling really well again. And so not only did it take a long time, it also cost a lot of money. So something that I really want to be able to give my patients now is a shortcut to all of that, to navigate through the different healthcare professionals that are available and the different treatment modalities and the confusion surrounding diet. So that was part of the motivating factors to developing this service. So I guess that's a really long-winded way of saying I have now co-founded Plant-Based Health Online with my friend and colleague. She's incredible, Dr. Shireen Kansam. She's a consultant hematologist and a lifestyle medicine physician like me. She also founded Plant-Based Healthcare Professionals UK. So they're an education organisation on the power of plant-based nutrition as optimal nutrition and for sustainable health. And so Plant-Based Health Online is really a service arm to that. So it's a new online healthcare service, and really exciting because it's the first of its kind in the UK, in that we're the first online plant-based healthcare platform to be regulated and registered with the CQC.
Yeah,
so that's pretty.
And the CQC, if you just explain to everyone how important that was for you to get that certification. Yeah,
really, really important, even if it was just so that I didn't have to go through their very rigorous interview process again. But the CQC is the Care Quality Commission, so they're the independent regulators for all health and social care services in England. So they make sure that our services meet government standards and that our organisation is safe and effective, that we are responsive to our patient needs and that we're well led. But what's so exciting is that they haven't approved registration for a service similar to ours ever before. Like, we're the first in the UK to be able to offer this. So patients will be able to connect with a plant-based healthcare professional through our online platforms. We use video consultations. And we have a really amazing team, an expert team of dietitians, nutritionists, a health coach, and 3 GPs, including myself.
Yeah, and so basically you can schedule an appointment. You also have the ability to send over like a home kit for testing of blood, and then that comes back to you with the results. So you get to see that straight away. And the other thing that I found quite interesting is when you spoke to me before about prescribing the medication, which is quite awesome. Like you start to reduce the impact of their medication that they're currently on.
Yeah, that's right. And it's something that up until I adopted this approach, this nutrition first, lifestyle first approach, that I never really had the opportunity to do with my patients. If anything, it was the opposite. It was always increasing the dose, adding on more medications. Whereas we find now that it's very unusual to do that actually if patients are compliant with the changes we recommend. And what we see much more often is that we are needing to reduce doses of blood pressure medications, reduce doses of diabetic medications, if not bring them off completely. I mean, it's so incredible. But so what we're able to do through our platform is link up with it's a private pharmacy, but they're able to deliver prescriptions to patients to their door, which is pretty handy.
Yeah. And then you can update their GP with all the changes that you've recommended, etc. as well. So you'll be writing to the GPs.
Yeah, which is a really important point to discuss actually, because something that we don't want to do is take people outside of mainstream medicine away from their GP. Like, that's not the idea at all. And what we really want to do is support people alongside their GP, their primary care provider, or specialist, for example, and help them along their journey to recovery. So I think we will always be asking people to share their information with their GP, because that means that their care is going to be more safe that way, that there's continuity of care. And it also provides, just from my point of view, it provides an opportunity to help explain what we're doing. Like, I think a lot of my colleagues are sometimes a bit hesitant, resistant, or confused about the approach that I take. But it's really important to stress that all the recommendations we make are evidence-based. And so it's a useful opportunity to educate both the patient and their healthcare professional in terms of the approach that we're taking, which is cool.
Yeah, very cool. So we're in the midst of the pandemic right now with COVID-19. How much do you think is lifestyle and diet related, especially to, first of all, catching COVID-19, and also the speed at which you could recover?
Yeah, I mean, it's such a fascinating topic, and also something, I guess, to just discuss quite carefully as well. But we knew very early on that your baseline health was really important in terms of not really whether you caught COVID, but how you responded, like how severe your outcomes might have been if you did catch COVID. So I think it was April 2020 when data was coming out from Italy and then the States that showed approximately 90% of the people who were hospitalized with COVID had an underlying health condition. And those conditions are the same common chronic conditions that we see. They were a pandemic even before the pandemic of coronavirus. So things like heart disease, type 2 diabetes, obesity, these were all things that we were all struggling with before coronavirus, but there is that link that they are associated with more severe outcomes with coronavirus. So you're more likely to be admitted to hospital, more likely to be admitted to ICU, and more likely to die ultimately from coronavirus. And the thing that's really important about these conditions is that we know about 80% of them are preventable with optimal diet and optimal lifestyle habits. So that's where the connection is, and that's why it's so important.
Yeah. And how important is it to have a healthy gut? I think we spoke previously about this recent survey, right? That you had research, that you'd read.
Yeah. So there's a paper circulating just last week, although I think it was published a little bit before that. It was from it was quite a small study, but an important one in China. and it showed that the gut microbiome was severely altered or imbalanced in people who had severe coronavirus, and also that even when their body had cleared the virus, that they were left with this imbalance in their gut microbiome. I mean, it's such a hot topic, the gut microbiome, and its link to our overall health is quite incredible, really, in so many different ways. But what was particularly interesting about this study was that, I mean, I'm not even going to try and pronounce the bacteria, the organisms that they show, but what I do know about them is that they thrive on fibre, and then which is dominant, is found or is rich in plant-based diets. So fibre is not found in any animal products. So we know that if you're eating a plant-based diet, you're getting lots of fibre, which in turn is really helpful for these microorganisms in your gut microbiome. And what they then in turn do is produce something called short-chain fatty acids, which have so many health benefits, but in context to the paper that we're discussing, it really showed that they are able to optimize the way our immune system works. So if we kind of extrapolate that information, it suggests that if we improve our gut microbiome, and we can do that in lots of different ways, but the key way of doing it is with a fibre-rich plant-based diet, then we can improve our outcomes and possibly our recovery with coronavirus 19.
Yeah, that's really interesting. And so, I mean, you get definitely loads of different types of vegetables that will have, which will be high in fibre. And also you need fibre to absorb different protein levels, right? So even if some people are thinking, oh, I just have the protein, but you actually need a lot of fibre in order for you to also absorb that, right?
Yeah, it's the key ingredient for so many different health benefits. Actually, there's also been another study showing that fermented vegetables in particular are really helpful for gut microbiome and probably reducing severity of COVID-19. But yeah, any vegetables, nuts and seeds, fruits, legumes, whole grains, they're all rich in fibre, and they're all really important, not just for improving our immune system, but for helping us to maintain a healthy weight and help our digestive system, reduce our risk of heart disease and cancer. I mean, the list just goes on and on. I mean, we know as a society, people are so focused on protein, but actually we're all getting way more protein that we need, but so many of us are fibre deficient. And I'm sure if more people increase the foods that are fibre rich in their diet, we would all be doing a lot better.
Totally, yes. Do you also have an opinion about the association of low vitamin D levels being linked to higher chances of getting COVID-19 as well?
I do. I mean, I have an opinion, but I also need to follow the evidence, right?
Yeah.
So, I mean, we knew even before coronavirus that vitamin D or adequate vitamin D levels were so important, and that if they were normal, it would help us to reduce the chance of chest infections, for example. Like vitamin D is actually a hormone. It's got much more to do with our health than just absorbing calcium and protecting our bones. Like it optimizes our immune system and reduces inflammation. It prevents us from cancer and autoimmune diseases, and improves pregnancy outcome. Like, there's so many different things. But yet there have been some studies that have suggested that suboptimal vitamin D levels are associated with more severe COVID-19 outcomes. So yeah, there's a definite link, but despite that, people should be thinking about their vitamin D intake. And in the UK, in the autumn and the winter months, so between October and March, we should all be supplementing. Like, no matter what diet we're on or what color our skin color is, we'll be supplementing with vitamin D.
So, there's different dosages. How many international units do you think you would recommend in those winter months?
Yeah, I mean, the NHS recommends 400 international units a day. I think this is pretty low, especially if you're deficient. It'll take you a very long time to get your levels back up to normal. So the thinking, like more recent thinking, is around 1,000 to 2,000 international units a day, and definitely no more than 4,000. 4,000 is a max for your daily intake. Mm-hmm. And there are certain foods that have vitamin D, but to be honest, the amounts are so small, and some of the foods are not suitable if you're vegan either, like eggs or oily fish, for example. So I think it's just really important. And like I said, anyway, irrespective of your diet in the winter months, we should all be supplementing.
Yeah, and I guess the other source of vitamin D would come from wool as well, where they extract it from wool. So that's not also suitable for vegans. So you can find the different sources of that, which is vegan. Yeah.
Yeah, you can. So vitamin D3, which tends to be more effective at raising your blood levels, and vitamin D2, you can get vegan sources from lichen. So you just need to be careful with the source. If you're very strict vegan, that you check where your sources are coming from.
For sure. Coronavirus is a zoonotic disease. How important is that for us to know about
that? Really important and urgent, if I'm honest. I think that it's a really big missing piece of the conversation around coronavirus just now. I mean, zoonotic diseases are not a new phenomenon. So a zoonotic disease is a infection that's passed from animals to humans. We've, people might not know exactly what they are, but they'll certainly recognize things like measles, chickenpox, HIV as these are all examples of zoonotic disease. And at the moment, they, before coronavirus, caused 3 million deaths a year. And so they're really significant. But coronavirus is an example of a zoonotic disease, and significant for us to think about, because it's not just about trafficking animals or wet markets. It's also to do with industrial farming and how we are invading animals' natural habitats because of our demands for meat. So what this is doing is increasing zoonotic disease at an alarming rate. They're increasing with frequency like we've never seen before. And so I think that transitioning to a plant-based diet where we're reducing our demand for meat is going to be a really important step for us to try and prevent pandemics like coronavirus in the future.
What sort of illnesses can be reversed, in your opinion, and especially evidence-based?
There's overwhelming amount of evidence for a plant-based, like a healthy plant-based diet and a lifestyle approach for most of the common chronic diseases. I mentioned some of them earlier, but heart disease, type 2 diabetes, obesity, Alzheimer's, even, and certain cancers. I've got to be pretty careful about using the term reversal, which we used to do a bit more liberally perhaps, but with heart disease, for example, can't say that it definitely reverses it, just because the criteria to confirm reversal are pretty strict. But there's very good evidence that using this approach can prevent these diseases, it can treat them, and in some cases, especially with type 2 diabetes, actually you see a reversal, which is really incredible. And like I said before, was not something I was even aware of, never mind seeing in my practice. And, to the point where patients would turn around and say to me, because their A1C, so their sugar, their 3-month average sugar level would be normal, and they would say, do I still have diabetes? And I would say, I don't know, because I had never seen that before. But now I know better, and now I know that it's really possible. And actually in, I think it was June last year, the American College of Lifestyle Medicine released a position paper on type 2 diabetes, saying that this is the goal we should be reaching for as clinicians. We can use a whole food plant-based diet approach with appropriate lifestyle measures to achieve remission of type 2 diabetes. And just feel like everybody needs to know this, patients and healthcare professionals. The NHS spends £14 billion a year on diabetes treatment.
Yeah.
And I think if only they could spend that money on showing everybody how to cook a plant-based diet, and we'd all be in a much better position. You know, and I talked about the evidence, and we know like there's so many important studies like the Adventist Health Study and the EPIC Oxford study that show vegans who exclude meat from their diet have 49 and 50% reduced risk of diabetes. I just feel like not enough people know about that.
Yeah, for sure. And, you know, everywhere type 2 diabetes is a global problem. And obviously some countries are a lot worse than others. You know, some are over, 50% of the population, for example, right? It's just going crazy at the moment. So, it makes no sense why people might want to try and reduce their odds from getting it, right?
Yeah, exactly. And the thing is that it's so closely linked with heart disease and with obesity and with cancer risk, and all these things fit really nicely together, or not so nicely as the case might be, but what I'm trying to get at is that they're all connected. And so that's really powerful for me as a physician when I am encouraging people to make these changes, that I can say it's going to help you with your type 2 diabetes, but you also get the added bonus of reducing your cancer risk and reducing your heart disease risk and getting your weight down. And, it has all these interconnected benefits as well, not to mention that they're able to reduce their carbon footprint of their diet and work towards planetary health and
sustainability. Yes,
all those things. So it really is a huge win-win for everybody.
So you've mentioned already type 2 diabetes could be reversible. Is there any other diseases that you see that could be reversible?
Yeah, I mean, not so long ago, I reread The Alzheimer's Solution by Dean and Aisha Shirzai. It's something I read over and over again because it's full of amazing information. And that was, again, something that I had never been taught was reversible, which was Alzheimer's. So certainly not kind of severe end Alzheimer's that has already progressed far, but certainly for patients where they have very mild to maybe even moderate symptoms, we know that whole food plant-based diet and certain lifestyle modifications can be really important, especially for preventing, probably for treating, and then like I said, definitely for treating, but probably for reversing mild and maybe even moderate cases. And I think this is just so relevant because the World Health Organization recently came up with statistics showing that by 2050, there's going to be more than 135 million cases globally of Alzheimer's. Wow. And this is phenomenal. It's going to cost something like $20 trillion globally, which is a figure hard to even wrap your head around. But to put it into perspective, it's thought to be enough to collapse the whole global financial system. So it's just important, even for those who are 30, 40, in their 50s, and where Alzheimer's is not really something on the radar, although it might be if they're caring for an elderly relative, for example, that we think beyond just now and beyond coronavirus, for example, and think about protecting our health and our brain health for further down the line.
And what about type 1 diabetes as well?
Yeah, so there is less evidence for definitely preventing, but also treating and reversing type 1 compared to type 2, where the evidence is abundant and quite incredible. But there has been some association with cow's milk protein and developing type 1 diabetes, which is an autoimmune disorder. But what's been really amazing, I've had a couple of patients with type 1 diabetes who have adopted a whole food plant-based diet, and they've really been able to reduce their insulin requirements, which is amazing. But they also know that they are doing the very best they can to reduce their risk of heart disease, which has a strong association with diabetes, and just improve their general health and their quality of life.
And on the topic of cancer, you've also read some good books on that, right?
Yeah, I have. And again, this has kind of come from my own research. So after my own diagnosis, like I have seen so many specialists, endocrinologists and oncologists and family physicians, and they've all been wonderful. But none of them mentioned nutrition to me or any lifestyle habits, for example. And my mum also, unfortunately, has had 2 cancer diagnoses as well, and thankfully she's doing fine. But again, similar picture with her, like nobody has mentioned the importance of diet or lifestyle with her either. And so I think as healthcare professionals, we need to do a much better job at helping our patients understand that these factors have a really key role into improving outcomes, improving survival, and just improving quality of life. So the book that you were referring to is called Radical Remissions by Kelly Turner, and really opened up my eyes, because as I was discovering that maybe non-conventional methods of practicing medicine were really important, and kind of opened up my eyes to thinking about things that I wasn't taught about in medical school, like spirituality and social connections and positive psychology. She talks about diet and lifestyle, avoiding toxins like alcohol and smoking, maybe ideas that were more familiar to me. But I've talked about evidence-based medicine being so important, and it is. And when I talk to my patients, it's really the approach that I have to stress. But at the same time, it just made me realize that there's more to life and there's more to healing than evidence-based medicine. And so I think a combination of the two things and just being open-minded to all of it is really important. And so the cases that she talks through about these incredible patients who have gone into remission at a time where their physicians didn't think it was possible is completely inspiring and totally captivating.
If we adopt a plant-based lifestyle, how much of cancer is preventable?
Such an important question, and hopefully able to do it justice with this answer. But the current statistics for cancer are quite mind-blowing, really. So for people born after 1970, it's thought that cancer can affect 1 in 2 of us, which is a horrible thing to think about. But what is a more positive spin on it is it's thought that 40% of cancers are actually preventable following a whole food plant-based diet and improving lifestyle factors such as regular physical activity, making sure we sleep and manage our stress, for example. This is not true for all cancers, but most of the evidence surrounds colon cancer, prostate cancer, and breast cancer. With colon cancer, what I think most people don't know is that back in 2015, the World Health Organization classified processed meat as a group 1 carcinogen, so definitely causes cancer, and red meat as a group 2 carcinogen, so probably causes cancer. But that link between processed and red meat and colon cancer is there and very strong. So much so that we know that for every 25 grams of meat you have per day, you have a 20% increased risk of colon cancer.
Wow.
Yeah, it's really quite incredible, and certainly something that's not talked about often enough.
Yeah, and I haven't seen so much of that as well. And so obviously, a lot of people have been affected, especially young people. Chadwick Boseman as well died last year in 2020 in August due to colon cancer,
which is so terribly sad. And we are seeing an increase in the number of young people, so those aged 20 to 39, and having colon cancer. And whilst the exact cause is not yet well established, there's probably an element of poor quality diets and diets that are high in processed and red meats, for sure.
Yeah. In terms of when you were talking about the you know, especially in terms of longevity diets. You know, you have different countries where they've defined them to be blue zones, where, you know, these people are living mostly plant-based diets. They also have a strong connection with their communities. I think it just goes towards to what you're saying, and especially written in this book, right?
Yeah, I loved hearing about the blue zones. When I was at the Harvard course that I mentioned, Dan Buettner was there presenting his photos and his stories, and it was really incredible to think how these people have lived their lives. And it's not a new way of life; it's how they've lived them for, you know, years and years and centuries and centuries. It's really powerful to think that we can take so much inspiration from these people, and how much they can teach us about how we should be living our lives. And yeah, it does put such an eye-opener out there in terms of how important our diet is, and how we work and live within our communities, and all those good things.
Mm-hmm. Do you happen to have any case studies that you would like to share? Either people that you've have been your own patients, or, you know, colleagues that you're aware of?
Yeah, so many. It's hard to know where to begin. And honestly, like, it makes me smile thinking about all my patients, and, you know, I'm so proud of them for all the changes that they've made, because it's not always necessarily very easy. A lot of them have, you know, real barriers in the way, like their partner doesn't agree with their new way of eating, or they don't know how to cook, or, you know, they have pain and they don't want to exercise even though I'm telling them that they should. And so the changes that they've made have been really incredible. I mean, I have patients who, like I mentioned before, have managed to come off their diabetes medications and are now, would not diagnose them as diabetics, which is incredible. I've had patients who, you know, have made some small changes but have had massive impact on their health. Like, I had a 40-year-old guy who was drinking about a litre of Coke a day but decided to give it up, and he, like, massively reduced his cholesterol, and then was able to implement other healthier changes as well. There's a really amazing bank of case studies on the plant-based health professional site. Kate Dunbar, for example, I've used her name, but her name is up there on the website.
Right.
The history of psoriatic arthropathy, so really bad arthritis, where she was in a lot of pain, that she was not able to go to work, she wasn't able to do her normal activities. And she was, I believe, vegetarian and then vegan, and then adopted a whole food plant-based diet, and just saw this incredible improvement in her symptoms, was able to wean off her medication. And she now regularly runs a 10K and doesn't think about it. In fact, in her case study, she talks about how she runs past her GP surgery and feels amazing while she does it. That is really amazing. There's also stories of, you know, medical students, and there's a story of an orthopedic surgeon who adopted a whole food plant-based diet, was able to put his diabetes into remission. There's plenty of case studies of people who have followed this same diet and able to lose weight or reverse their reflux disease. I mean, there's so many stories there, and they're all incredible. They're all very, they make me very emotional actually reading them, and I would encourage everybody to do that.
Awesome. And so you're live now, and where can people find you? Like, I'll put the domain up, and you know, the idea is that you'll create, I think, 3 sessions. You booked 3 sessions before, is that right?
Well, at the moment, so we are asking people to book 2. And there is a reason for that, because if you have one introductory session and then don't come back for a follow-up, it's really hard to know, you know, whether there's, you know, things have gone really well, or if there's been lots of challenges and you've given up, or if, you know, it can be a whole spectrum in between that too. And the other thing about having a second follow-up appointment is it holds you accountable to some changes. So yes, we encourage people to book an introductory session and then have a quick follow-up afterwards, and then those regular follow-ups you can book them how you want to after those 2 initial sessions.
Yep. And obviously only available in the UK at the moment.
For doctors, yes. So our GPs are GMC registered and they can only practice in the UK. But our dietitians, nutritionists, and health coaches are able to see people worldwide, but excluding the States and Canada.
Okay. So I guess there's other platforms out there that are plant-based in the US and Canada, or is there not?
Yeah, there is. There's a few some friends and colleagues who are doing something similar, but yeah, there's nothing in the UK. So it's really nice for us to be able to offer kind of UK focused services.
Sure. Okay. Well, great. And I wish you the best of luck with this launch. Really looking forward to hearing more brilliant case studies coming up and people really making more positive changes. So yeah, appreciate it.
I can't wait for that. And that's going to be the ultimate goal, is to be able to come back here and then give our own plant-based health online case studies. That would be a dream.
Yeah, definitely. Let's do that. Okay. Thank you so much and speak to you soon.
You too.
Bye.